Let me begin by first thanking each one of the businesses, the restaurants, the malls, retailers, workplaces who are helping us take social distancing seriously, helping people stay home, who are sacrificing to put public health and safety first. And this is not an exaggeration. By taking the steps you are taking, you are putting health and safety first, and you are helping save lives. I know it's not easy, but we see you stepping up, and we thank you for it. And we thank every single resident of this county who is working to stay home, to stay away from crowds. I can see folks following those instructions, and we can even more of that, because what we can control right now amidst all the uncertainties is trying to keep our distance from one another, necessary contacts, so that we're not spreading the virus and we're stemming the flow of that. As you guys know, as of this morning, last night, we had 18 cases in unincorporated Harris County. We have one more that Dr. Shaw will go over that came in just this morning. Yesterday, the city of Houston announced five more just in one day. The rates are increasing. This is here right now, and we have got to double down and do our part. In the meantime, remember to support our restaurants, our businesses who are taking these steps. Order online, drive-through, pickup. Again, no crowds, but do support these establishments. I want to make an announcement related to the impact that this has had on our community. Of course, these are all jobs, and that's why it's so difficult for us to take these steps, but we do it in the name of public safety and making sure we do everything we can to avoid a situation like Italy or what other parts of the country are seeing. And so one of the steps we've taken and we're taking today is around evictions. Today, the justices of the peace in Harris County are prepared to announce, or they will not conduct eviction hearings through at least the end of March. So to repeat, the justices of the peace in Harris County will not be conducting eviction hearings through at least the end of March. We're continuing to work with them to extend this for however long our community needs it. And if needed, I am willing to sign an order to continue to ensure that this takes place. I want to point out, of course, as exigent circumstances, domestic violence, violent crimes, but generally we don't want people out on the street simply because they're out of a job because of the coronavirus and now they're losing their homes. And so first I want to thank, of course, our justices of the peace, the 16 leaders who have stepped up on this, the apartment association with whom we've been in close touch, and all the members who understand the importance of this and are stepping up as well, the community advocates who've helped make this possible, and everyone who helped implement it. This is a matter of safety. It's not just a problem on the economic side for families, but this is also not the time to be putting people out on the streets. This is the time to remove obstacles in the way of families dealing with school closures, with job losses, with the unprecedented disruption to daily life. And we know that this is a primary way to make sure that we are stemming the spread of the virus, because we're asking everyone to stay home and we need them to have a home to stay at. And so I want to just thank again everyone who's been working on this. Today my message continues to be simple, and that is stay home. We need people to help with us. We're in a critical window of opportunity where we can either contribute to the spread of this virus as we see it quickly speed up in its spread, or we can help stop it in its tracks. I've discussed before how we still have not received the federal materials we need to truly increase significantly our testing capabilities. We are working with the hospitals to maximize their capacity, but we know no matter what they do, they will we will never have enough capacity to sustain the kind of increase that could take place in this community. And so what we can do, what is in all our hands, is to ensure that we're not passing along the virus, whether it's folks who are at high risk or it's young people. This is not the time to be at the store, to be at the mall, to be in groups in any kind of setting. For a house party, this is not the time for that, and we need everybody's help with it. So please, unless you absolutely need to purchase necessities, and in that case, ensure you stay 6 feet away from people, please stay home. Finally, let me share another life-saving resource that's now being made available, and that is a mental health resource. We know that this is a difficult time for folks. It's hard for us to stay home. We feel lonely, our lives are disrupted, and so it's a challenge on the mental health side. The Harris Center has activated a mental health line that's available to the public. You can find the information for the line and all other kinds of resources, like how to volunteer, how to report businesses who are not complying with our order, how to, frequently ask questions, rumor control, all kinds of resources at readyharris.org, and the mental health hotline at 833-251-7544. Now, I do want to make a note on the situation at the port, and Chairman Campo will be here giving the fuller update and answering any questions as well. But let me just say that first of all, our port and the purpose it serves is essential. They're not going anywhere, and we need them to continue to ensure that we receive the goods and services. We have been notified of a worker who was at both terminals that the port maintains and operates, and so Chairman Campo has opted to close those down temporarily while the situation is sorted out. Remember, delays are built into the supply chain. We routinely face issues with weather, fog. We routinely see, goods take about a month to arrive from certain places, and so delays are built in, and we are working to get this up and running as quickly as possible. Cargo ultimately flows like water. It'll find a place to go, and we'll make sure that our community is receiving the goods it deserves. So I want folks to know we are wholly focused on getting the terminals back open, and for now, at least in the short term, the impact is in a way already factored into the system, and so that buys us time to get this work done and ensure that there aren't severe disruptions. And so with that, let me repeat my remarks in Spanish, and then I'll welcome Dr. Shaw and then Chairman Campo to give their updates, and we'll take questions. En español, primero quería agradecerle a todos.
You've been listening to Harris County Judge Lina Hidalgo reiterating her message to residents of Harris County to please stay home as we all work to slow the spread of the coronavirus. Several important takeaways from this news conference as we step away from a moment while she speaks to folks in Spanish. One of the things that she talked about was the closure of the Bayport terminal and the Barbers Cut terminal. Barbers Cut terminal, one of the busiest ports in the world in terms of cargo tonnage. One of the things that she said, delays are built into the supply chain, so they're now working on ways to get the ports up and running as soon as possible, but they certainly don't want folks to be overly concerned with the fact that they had to close down these ports because an employee tested positive for coronavirus. Tanaya.
Yeah, and Andy, she said again, you shouldn't be worried about that. As you mentioned, the delays are built in, but she said they are sure the community is going to get everything that it needs. Another big takeaway that she mentioned was the mental health resources available. She said she knows that so many people are at home right now and their routine is disrupted. They could be dealing with some possible mental health issues. She said the Harris Center is going to have a mental health line. That number is 833-251-7544. And again, all of this information is listed online for you. So that is going to be a big resource for a lot of people. As you mentioned, she said her main message was to stay home. But she also said, we can't forget about supporting our local restaurants. We know that a lot of them because of the social distancing, you can't actually go to the restaurants. They're not doing their dine-in services, but you can do the pickup, you can do the delivery. So again, it is so important to continue to support our local restaurants, because right now, so many people, their hours are being cut and they could potentially lose their jobs due to these closures from the coronavirus.
Yeah, and Judge Hidalgo also making it a point to say, look, we have not received the federal materials that we need to ramp up our testing capabilities of coronavirus in our area. A testing site is set to open coming up at 10 o'clock in North Houston at United Memorial Medical Center. It'll be open until 8 o'clock this evening. That testing site in North Houston expects to test around 2,000 people a day who will be showing up there because they have symptoms. Houston Congresswoman Sheila Jackson Lee making that announcement tonight. We know that some private clinics have some testing capabilities up and running as well. One private clinic in Southwest Houston, but in less than 24 hours, the greater Houston area saw a jump in the number of cases. We went from 39 to 62. So again, Judge Hidalgo making that plea to the federal government. Hey, look, we need more resources. We need more testing capabilities brought into this area, because as our local officials have been saying, and as officials have been saying around the country, they're expecting the number of coronavirus cases to spike over the next 4 to 5 days. This is something that we heard yesterday, and that same message continues this morning, Tanaya.
And Andy, with the expected 2,000 coronavirus tests that are going to be available at that drive-through testing, you know, those numbers could rise. We could hear more. We're expected to hear from Dr. Shaw coming up in just a few minutes in this live news conference. But as of right now, the death toll stands at 3. Another thing that Judge Hidalgo just said a few moments ago was the justice of the peace here in Harris County. They're going to they're not going to do evictions for the rest of this month. You know, they say they do not want people out on the streets. They don't want people, you know, out, because we're telling you, we've been saying for over a week now, just a while now, please stay inside. You need to social distance. You know, this virus can, we mentioned this morning during our morning newscast, the virus can live on surfaces for several days, up to 3 days, I believe we said. So, you know, it's important to wash your hands. Haley's been giving us all the tips. Make sure you wash your hands for at least 20 seconds. Use soap and water. Just hand sanitizer whenever you can. Don't touch your face. You just have to be mindful of these things, you know, that we might not be thinking about every day prior to this. You know, you touch your face, little things like that, the doorknobs. But it's really important to be, you know, extra clean, especially at a time like this, Andy.
Good health practices and social distancing, which is something that all of us have been practicing.
Right now, even further.
Right now, you're on the other side of the studio. I'm here at the anchor desk. We also expect to hear from Texas Governor Greg Abbott later this morning. He is scheduled to hold a news conference at 11 o'clock this morning. He's potentially going to talk about the state taking more action to prevent the spread of the virus. Yesterday, he announced another initiative to help out restaurants across the state of Texas. He was allowing them to deliver alcoholic beverages with food orders to customers. So certainly, you know, a lot of these businesses tonight that have been forced to shut down abruptly and lay off employees because they just don't have the volume of traffic anymore. You know, any help that these restaurant owners can get, you know, it's coming at a very crucial time for them.
No, 1,000%. You mentioned the closures. We mentioned this earlier today. All Texas Department of Motor Vehicle offices, well, they are closed today, but they say you can still do their services by mail, email, and the phone. You know, Governor Abbott even issued a temporary extension for people needing things like their registration, their vehicle titles, the renewal of their disabled parking placards, even the malls. So many of our big malls in this area are closed now. The Galleria, Katy Mills, Houston Premium Outlets. I mean, they don't want people to really go out. They said groups of 10 or fewer, and that's even be kind of a lot right now. Some places, San Francisco, they're in a shelter in place right now. You know, they really want people to stay inside so we can stop the spread of this virus.
Yeah, it's certainly taking some time for all of us to navigate this new normal. This is our new reality, and with that, you know, comes anxiety in these uncertain times. One of the things and the messages that we keep hearing over and over from officials as they continue to update us on this evolving story is, look, now's not the time to panic. Now is the time to prepare. Let's listen back in to Dr. Umair Shah with Harris County Health.
So the local health authority for Harris County, and I just want to thank the judge for providing opening comments where she has really provided all the essential updates, but I want to just add and echo a few additional points. First of all, as she mentioned, these are unprecedented times for all of us. We know how difficult this is for our community. It's difficult for all of us. It's been a challenge for the kinds of things that we've been both watching in the news across the world, but also now seeing things in our own community. We recognize how difficult that is for all of us, all of our community members. And so I just wanted to reemphasize the fact that we're in this together. And this really requires all of us to work together. And that includes those activities that we have been saying from the beginning, which is all the things that you can do to essentially assure that the people that are around you, especially if you're sick, that the people around you are protected, that you do not infect someone else. At the same time, we want to make sure that we are doing everything we can to limit the amount of people that are in close contact and gatherings. The judge mentioned that as well previously. There are a lot of efforts that we at the county have given in coordination with our other partners across the region to really recognize that we have to do our best to slow this virus down. Slowing the virus down gives us the best opportunity for our healthcare system and all of us in the community to be able to handle a potential surge of individuals that may be either very sick or requiring hospitalization or requiring more intensive levels of care. So that's absolutely critical to what we're attempting to do. So everything that we have been working towards over the last few months, but especially the last few days to weeks, is really about slowing the virus down. It's about flattening the curve. And I do want to make mention, as the judge recognized, that Harris County Public Health had confirmed that we had additional cases yesterday for novel coronavirus. The city of Houston also confirmed additional cases yesterday evening, and now we're confirming an additional case this morning. That brings our total to 19 cases, confirmed cases, in the Harris County Public Health jurisdiction outside of the city of Houston. And with the city of the 10 cases they have at last count, that gets us to 29 cases for Harris County as a whole. And that's not inclusive of other cases in the region. About the individual that was confirmed, that I'm confirming now, this is a 40 to 50-year-old male, no history of travel, no history of exposure to novel coronavirus. This is an individual who's hospitalized. It's from the northwest quadrant of Harris County. And our concern, of course, is the hospitalization, really at the end of the day, the recognition that this is not novel coronavirus, that we have been talking to our community and all of you about the fact that a very good portion of people may be without symptoms, or they may have mild illness, or they may be home after they get diagnosed. But now we're starting to see individuals who are hospitalized, and even from some of our couple of cases that we diagnosed or confirmed over the last couple of days, they're actually in more difficult circumstances in the hospital. So I want to just make that known, that it's not just about getting a novel coronavirus, COVID-19, and moving on with your day, that we are very concerned, especially about at-risk populations, those who are seniors, elderly, those who have underlying medical conditions, those who have compromised immune systems, pregnant women. These are individuals in our community that novel coronavirus has shown across the globe having more impact. And so we have to do everything we can, the rest of us, to assure and do our best so that we can protect others around us. So this is really why the community is so critical to this effort. I did want to also make a couple of more comments. One is about the port. Our team is working very closely with Mr. Campo, and we really appreciate, Mr. Campo, your leadership and your partnership to really continue the investigation and really understand better what the degree of risk is at the port. We're still in the midst of that investigation. We recognize the importance of the port to our community, and we're doing everything we can to work through that as quickly, efficiently, but also as thoroughly as we can. So I wanted to make mention of that. And then the other thing I wanted to say is that the judge absolutely emphasized the importance of the mental health aspects and the anxiety aspects of what's happening. So we know that life as we have known it has changed. Even in this room, there used to be a lot of our media partners with us. Now we're doing a lot of this by video conference or by feed, and it's important for us to remember what we see used to see in restaurants or in bars or all across our community. Life has changed, and we know that is one that we have to all cope with, but we also have to recognize the importance that, and especially for some individuals, that is very difficult, especially when we think about what our children are seeing in images. So one of the messages that both Harris County Public Health and the Harris Center for Mental Health and IDD, what we're wanting everybody to know is, one, there are resources available. The judge mentioned through readyharris.org, there are a number of resources that are available that the Harris Center has put up. We also have been recognizing the absolute importance that we have to take some mental health breaks ourselves. We have to do everything we can to boost our immune systems and sleep and assure that we're taking our vitamins and we're getting all the rest we can, but we also have to do our best to, at times, take a break from all the news that we're hearing about novel coronavirus across the world, and really make sure, especially our children, are taking that break to be able to cope with things at home. And whatever you can do in your homes with your children, your young ones, to be able to help them get through these difficult times. They have never seen these times before, and honestly, many of us, most of us, haven't either. But we have to do our best to work together with our families and really those that are the most youth, our youth in our homes and our communities. And then the final thing is around the judge's discussion around evictions. I do want to say that we are recognizing the absolute importance of that work. It is very important from a health standpoint that we do everything we can to really help our community during these difficult times, and whether that's from an economic standpoint, from waivers or some exemptions of certain activities or issues or challenges. We want to do everything we can to help our community through these difficult times. So again, I want to thank all of you for all the wonderful things you have been doing. Our healthcare partners, especially, I want to thank our frontline healthcare workers, our first responders, all of the individuals that have been really working so closely with all of us in government, our community members, and really everyone who is in this fight against novel coronavirus. We will get through these difficult times, but it's going to take some time to get through these, and we have to do it together. Thank you.
Well, thank you. I'm Rick Campo, the chairman of Port Houston. I'm also, in my day job, chairman and CEO of Camden Property Trust, an apartment company, so I'm going to address the eviction issue here after I discuss the port. But first of all, I want to thank Judge and Dr. Shaw for their leadership through this situation, this unfortunate and complicated maneuvering. Last night, the Port Houston received information that we had a worker, an ILA worker, that tested positive for the coronavirus. We have a task force that is focused on making sure that cargo continues to flow through the port. We had conference calls last night with the governor, lieutenant governor, the mayor, county judge, and other state officials and federal officials to make sure they knew what we were doing. We, in an abundance of caution, have closed both Bayport and Barbers Cut. Our first priority is safety, and for our workers and for anyone who comes in contact with the port community. The port is an essential business that has to operate. We have to bring in cargoes that everyday Houstonians and people who live in Harris County need. So we recognize that it's critically important to open the port as soon as we can. A couple of details. So that we had one worker that tested positive. He worked at Barbers Cut over the weekend and 9 days ago at Bayport. The good news is he had, we think, limited contact, and he wasn't a full-time port employee, so we have short periods of time that he was at those two facilities. So our protocol, what we're doing to go forward and to open the port as fast as we can, is we're doing investigation in conjunction with the ILA, with Harris County, and with our own port police and port fire.
You are listening to Rick Campo, chairman of the Port of Houston, updating us on the employee who tested positive for coronavirus. Two terminals at the Port of Houston remain closed, the Bayport terminal and the Barbers Cut terminal, where that employee worked. Barbers Cut terminal, just to give you some perspective, is one of the busiest ports in the world. So they are working on retracing his steps, investigating who this individual had contacts with. Tanaya?
That's right. And again, we just heard a few moments before this from Judge Lina Hidalgo. She said while the port is closed, they do have delays built into the supply chain, and they are, of course, working to get it back up and running again. And they're going to make sure the community gets what it needs. Again, they have to be safe, safety for the other employees there, but they are working to get the port back open again. We just lost audio, so we're working to get that back for you. So we'll go back to this in just a few moments. But Andy, we just heard from Dr. Shaw an update on the case number. He said there are now 19 cases here in Harris County, 10 in Houston, so that now brings the total to 29 cases in the Harris County, Houston area. And they said this latest person who tested positive for coronavirus is a man between 40 and 50 years old. They say that man has no travel history, but he's currently hospitalized because of symptoms from the coronavirus. This is another reason they're saying this. Originally, they were saying, the older population is more susceptible to this, but this man is anywhere between 40 and 50 years old. We don't really know right now. They haven't said if he had any underlying medical conditions or his exact history. But again, he's between 40 and 50 years old. So that's why they're saying, again, it's so important to just stay inside and just we need to stop the spread.
And as officials are urging people to follow the restrictions that are now in place, Dr. Shaw also trying to create a sense of calm, if you will. It's normal, he said, to feel anxious and unsettled as all of us adjust to this new normal as we find ways to deal with this new reality. But again, as officials have been saying since this crisis began, now is not the time to panic, but it's the time to prepare. Tonight we've been through trying times before as Houstonians, obviously under a different set of circumstances. We'll get through it by supporting each other, by lifting each other up, through reassurance. Dr. Shaw said, look, we'll get through this together. We'll come out stronger because we are literally all in this together.
We are all in this together. And as Judge Lina Hidalgo mentioned, now's a perfect time. You even just said to support each other. You've got to think about the small businesses and local restaurants who are now really feeling the effects of all of the, the no dine-in services. We're not allowed to go to restaurants right now because they're trying to practice social distancing. But again, you can still They have takeout, they have delivery services. There are so many things. And I believe it was Dr. Shaw just mentioned, he said life as we know it has changed right now. Just last Wednesday, we were doing the news conference when they announced the Houston Rodeo was canceled. And then after that, sporting events, the NBA, MLB, March Madness. They canceled March Madness, which is a huge tournament. The Kentucky Derby's delayed. These are big changes that, we haven't really seen things of this magnitude happen too often here, but they're serious. So they're really saying that people need to take this serious. This morning, I remember one of our stories in our morning newscast, we showed all those spring breakers out in Clearwater Beach, Florida. They're not listening to officials' warnings. They're going out in huge groups. So again, it's really important we have to listen to the advice they're giving us.
Yeah, certainly navigating the new normal, that is sort of what we are all faced with at this point. And one of the things that we heard Dr. Shaw talk about was for parents, now is the time to really sit down and talk with your kids about the current situation that we're in. Want to switch gears here now and go over to another news conference. Congresswoman Sheila Jackson Lee is currently speaking. Let's listen in.
But we have now Good Samaritans who have gotten the test, who committed to testing, and will do the work and work as hard as they can. I want to thank Sahid Mahinin, who is the corporate CEO and had this vision when we talked. I want to thank Dr. Moeen, who is the CEO, and Dr. Joe Varun, who is the Chief Medical Officer, Ms. Hebram, Director of Government Relations, and we are grateful to all of the medical professionals that are here. In order to get an understanding of what we're doing today, we're first going to hear from Dr. Joe Varun, Chief Medical Officer of the United Memorial Medical Center. And let me be very clear, we are bilingual, and we have a process that we walked through yesterday evening.
You've been listening to Congresswoman Sheila Jackson Lee. We're going to take you back to that news conference that was led by Harris County Judge Lina Hidalgo. Dr. Umair Shah with Harris County Public Health is speaking right now. Let's listen in.
We recognize that those providers who are, again, as I mentioned, are frontline providers who are providing care that there's the challenge that we're trying to balance is the provision of that care for our patients while we're also, one, protecting the very patient that is getting that care, the provider who's providing that care, as well as preserving the limited personal protective equipment, including masks and gloves, et cetera. So it's a balance that is really in place that everybody is trying to strike. While we are not making a formal recommendation to our providers, we are also working with our providers, including both in the medical and dental communities, as well as the veterinary community, to really get information out about what the guidance has been from other partners, whether associations or federal state guidance, as well as local regional guidance. And really, I think the main message is that if you're a patient who has a procedure that you feel can be postponed or rescheduled, please contact your healthcare provider, your dentist, and ask that question. Is this something that needs to happen now? And if the answer is no, then we would ask you to forego that procedure to a later time. At the same time, we're talking to our providers and asking our providers to do a very similar calculation. Does this procedure need to happen now? Is this something that I can forego? Can I reschedule? What is the potential risk benefits of providing that procedure? We're particularly concerned about dentists and the surgeons, particularly ones that do procedures that are of respiratory in nature in some way that allows for some additional aerosolization, if you will, with the procedure that they are engaged in. We know that many doctors, many dentists have already taken steps. They've already temporarily closed their offices for 2 weeks. They've already taken the appropriate steps with additional PPEs. If they've not closed their offices, they've already contacted their patients. So we are not making a formal recommendation, but we encourage that patient-provider relationship. We're also asking the state and our boards, as well as the associations, to really look at the science and the evidence to make sure that we protect not just our patients, but our providers. And so we are encouraging our state associations and state boards to really look at the science and to make sure that we are giving that appropriate guidance to our medical and dental professionals.
Thank you, Dr. Shaw. We've received several questions about testing from Houston Public Media. Are any county testing sites expected to delay openings due to people showing up early because of misinformation? From KHOU, I'm going to group these together because they're related to the same topic. Yesterday, the White House asked that elective surgery, we will soon, actually, hang on. There is free testing at Representative Sheila Jackson Lee's event today. private clinics are doing testing, but so far the county has not launched its public drive-through testing. Why is that? When will it start? How will screening work? New York's governor says they've...
I want to switch gears now and head over to the news conference where Houston Mayor Sylvester Turner is talking about the testing site that is up and running in North Houston. Let's listen in.
Tremendous help, and as a result of the passage of one, we're standing here today. And then let me thank United Memorial Medical Center, Dr. Varun, and the entire team, all of the partners. Let me thank them. Please give it up to them. Because today, what you can see is that some testing is starting to take place. And even in the private sector, which means we're all working together. Commissioner Garcia, we're all working together. We're all partners in this effort because one of the challenges is building up that capacity so that we can do more testing. And as you can see, there's a tremendous need for testing because that is the only way to give us some indication of what we are dealing with in the communities out here. So I really want to thank this group for their efforts in getting the testing started because even on the county and city level, we anticipate starting up on tomorrow. That is the hope. With the emphasis being on first responders and our healthcare providers as we ramp up. And so I certainly want to thank the Congresswoman, and again, I want to thank United Memorial Medical Center and all of their partners in this effort. And then lastly, let me just say as we move towards the weekend, let me just encourage people to minimize their activities. Let me do that. The social distancing, the social spacing, critically important. And so as we approach this weekend, let me encourage people to minimize their activities. But this is a situation we simply have to manage. Okay, it's going to take some time, but when we all work together, we'll get it done. And this is an effort, whether it's the private or the public sector, we will get it done. So thank you, Congresswoman.
Thank you, Mayor, so very much. Those are very important words. Let me, because we want to start testing quickly, just emphasize the mayor's words on a national level. As a member of Congress, we're trying to decide what our next steps are in returning, but we're writing the next bill for the things the mayor needs and all of the people who are unemployed. I do want to give my own message to add to the mayor nationally. No, we're not very happy with the spring break activities, not only in Florida, but in Texas. We ask our wonderful young people, please realize that you are now as well in jeopardy. We ask you to do social distancing. Families with spring break young people, please encourage them to know that they are now just as vulnerable by the new results that we've gotten as those of other ages. And so we hope we will continue to social distance, have a lot of fun on social media, but we certainly are hoping that the activities in South Texas and Florida will end as quickly as possible. We are partners with the county. We're delighted to have Commissioner Garcia working with Judge Hidalgo, Commissioner Ellis, and his other commissioners that work with them every single day to protect us and to provide good health care. Commissioner Garcia, and then we're getting ready to go and start immediately. Thank you.
Thank you. Congresswoman Lee, thank you so much for your leadership. Houston is grateful to you. Harris County is grateful to you because of what you've been able to deliver to the citizens of this community. Mayor Turner, I want to acknowledge the important and difficult work being done collectively by County Judge Lina Hidalgo and Mayor Turner, all with the balance of lives in the decisions that they are making. And so I fully support the direction that both of you are taking us in. I want to also recognize United Memorial Medical Center for their important work. Been on the conversation, on the phones rather, with these folks because they understood the concern and the anxiety in the community without access to tests. And so they have been working very, very diligently to make today happen. And so I'm very grateful to them. This is an opportunity, as Dr. Varun has indicated, that if you have the symptoms, please give space to those who have symptoms. If you feel fine, then this may not be the place that you need to be. But if you have a fever, if you have cough, if you have all the other symptoms associated with the COVID-19 virus, then this is where you need to be. And I'm also grateful that this is being able to be provided for free. So many others have been exploiting the circumstances, but I'm grateful that United Memorial Medical Center has been a leader, a very, very integrity-led leader in providing these tests today to make sure that citizens can go home with comfort that they've been tested and soon with results to come behind those tests. So we're very grateful, and Harris County, Houston stand together. Thank you.
I appreciate it very much.
I would be remiss if I didn't thank my own Houston Police Department and Chief Acevedo and all of the police officers who are helping to support this effort, and not only this effort, all of our testing sites. And so, Chief Acevedo, let me thank you. I really appreciate that. To all of our men and women with HPD, the Sheriff Department, and everyone else, all of our law enforcement personnel. Let me say thank you on behalf of all of you. So appreciate you.
Let me add my appreciation, Chief Acevedo. We couldn't have done it without you. In a moment's call, your team was here. You have been here when we open up the public sites for first responders. Your team will be here as well. And so I know that you'll be available for conversation for the moments that you will be here. Chief, did you want to say a word? You're good? You're available?
I'm available for one-on-one.
All right. Thank you. But we want to thank you. We want to thank Chief Pinier and the fire department, firefighters, and again, the folk that are dealing with this on site. Let me let you see what we're going to be having. We're struggling to get these personal protective equipment. Put on the mask. But she's going to just show you, and then we're going to, she'll come out. She'll come out. Come this way. Just put it on. Yeah. You're good. Okay. Social distancing. Okay. It's a shame. It's a shame. Oh, sorry. It's a shame that we're struggling to get this equipment, but again, the Defense Production Act is in place. And we've got to get the administration to get these produced, to get these down to our respective communities. That's what we'll be working on. We thank you so very much. I thank you to United Memorial Medical Center for answering our plea. It is free. We're grateful that the Families First bill coming out of the House has passed, and the money will help to do what we're doing, and we need to do more because we have to save lives. Remember what I said? We hope for the best, but we prepare for the worst, but we do not panic. We prepare. I'm going to let these guys get to work. Thank you all so very much.
Congresswoman, before you go.
I'm going to let them get to work. We'll answer them.
What's the capacity for testing here? That's something that you didn't touch on. This line stretching down.
And right there, you just heard Congresswoman Sheila Jackson-Lee. They are at the first free coronavirus testing site in our area, North Houston. They're taking questions now from some people. And again, Andy, we just saw the gear that they're going to be wearing while they administer those tests. And they're expected, I think they have up to 2,000 tests to give to people who are showing any symptoms who show up to this testing event.
And that testing site is open from 10 a.m. until 8 p.m. I want to take you back to the news conference where Judge Hidalgo and Dr. Umair Shah are fielding questions now from reporters. Let's listen in.
KP George, Fort Bend County Judge, with Judge Keogh in Montgomery County, and so those relationships are crucial and will continue to work together so that there's consistency. As I've mentioned before, we can't hermetically seal Harris County. We are not an island, and so we want to make sure that our neighbors in an area that is urban and suburban and even borders on rural and some counties counties, we want to try and have consistency to the broader extent possible. I know that the governor is in conversations about what decisions he will make, and I'll be looking out for that, any further announcements from him. So far, we've received a lot of support from his team in whatever the state can do to ensure that we have the resources we need, and a lot of it goes back to federal resources that we're still expecting and hoping for. And I do want to thank my colleagues in Congress for the package that they've been working on with the president. As far as the question on the shelter in place, we are exploring all kinds of policies right now. I am in constant communication with experts, with leaders in other communities. We are looking at other countries. We're looking at other cities and states and trying to pull out what is helpful and relevant for our region. We have got to be flexible. We've got to be smart. We can't be catching up. If we do the exact same thing they've done in other places where they already overwhelmed the healthcare system, we know where we're headed. We have to get ahead of this. We have to do better. That is what I'm committed to. And that means making difficult decisions, like the decisions we made yesterday, like the decisions we continue to make today, you know, the decision Chairman Campo has made. But we have to be aggressive about this, and that's where I'm at. So I will keep the community posted as we figure out our next steps. But for now, I'll say what we need you to do is to stay home, and we can't micromanage our population. We need each person to play their part, and the way we do that is by ensuring each of us is keeping a distance and not participating in any kind of activity or encouraging any kind of activity where there may be people gathering at all. That should just not be taking place. So that's where we are right now.
And we'll do one or two more because we're coming up on 1 hour. From the Katy Times, residents in Katy are concerned that having a testing center at Legacy Stadium may bring people with symptoms to local businesses and add to the risk in Katy. Is there an increased risk if residents are near a testing center?
Thank you for that question. There is not an increased risk if you're near a testing center. These testing centers, as they've been designed throughout other communities, and including the testing centers that we're designing here locally, are testing centers that are meant to be drive-through, that they're meant to be somebody in a vehicle who's going to be driving through and coming on the grounds and then moving forward with the specimen collection and then leaving out of that area. So these are not designed to be walk-up. These are not designed to be walk-in. These are also, as the judge mentioned earlier, that we want the individuals that are going to be there they have to be triaged there. So it's not that somebody can just walk there or even drive there and say, okay, I'm here to be tested. That's not the way these centers, the drive-through centers, are designed. They're designed to be triaged, that you get an authorization to be able to go there. And once you go there, it's really by vehicle. And so anybody that's in the surrounding area should not have concerns of individuals coming through, because, again, they would be just as you would have anywhere else in the community, somebody in a car, a vehicle who would be coming through, getting the specimen collection done, and then going on their way. So I just wanted to reemphasize that the risk to the community around these specimen collection sites is not there.
From Houston Public Media, the second coronavirus aid package was signed by President Trump last night. Will Harris County receive any funding or resources through this act? And as a follow-up to that, case numbers examined by NPR appear to indicated the notion that COVID-19 is only a serious threat to older adults is wrong. Would the way the outbreak has played out in Harris County and Texas support that conclusion?
On the question about the aid package from the federal government, we're still making our way through it. Harris County, unincorporated areas, would be the 5th largest city in the country after Houston. And so it's very important that part of that aid come to Harris County. Of course, if you count Harris County as a whole, we are larger than 26 states the size of Colorado in population. So we are advocating and we hope and believe that our legislative partners will help ensure that those funds arrive in Harris County as well. So we'll continue those discussions.